I am Matteo Bassetti. I am an infectious disease specialist based in Udine. I am the chief of the infectious disease department there and also a professor of infectious disease in the same university. So antibiotics were discovered at the beginning of the last century by Alexander Fleming, and after that the antibiotics were used a lot and they improved the survival of the patient affected with infections, and we consider antibiotic the miracle drugs. Unfortunately, antibiotics were too much used, and for this reason there was the concept about the fact that how the miracle drugs were destroyed, the miracle. Antibiotic resistance is the ability of the bacteria to resist to the antibiotic. So you give one antibiotic to the patient and the antibiotic doesn't work. So can be related to an acquisition of resistance, or the bug can be already resistant to the drug. Unfortunately, antibiotic resistance increased and spread all around the world. And recently, the number of antibiotics approved by the regulatory agency declined. And the problem is that for the future, we don't have new antibiotics in the next 5 to 10 years. When you have a urinary tract infection, you need a short course of antibiotics, usually with the different classes of antibiotics. And the advice to the patient is to consult the physicians in order to have the best treatment. Don't do the self-treatment, so that is not good for all the infection and also for urinary tract infections. It's very important to follow the prescription, to follow the rules regarding the use of antibiotics. Because if one antibiotic is given at the dose, you have to follow the right dose. Don't be up or down. So this is important. Then follow also the posology. So if the drug has to take at 8 o'clock in the morning and 8 in the evening, you have to do that 8 and 8. You don't have to do at 4 o'clock or midnight because you prefer to do that. And then also the duration. So if one antibiotic has been prescribed for a duration of 7 days, you don't have to stop after 4 days just because you don't have anymore the fever or the symptoms. So you have to continue until the total course. For recurrent urinary tract infections, there are different strategies. The first and most important is regarding the behaviors. Try to change the behaviors of the patients affected by this kind of infections, like hygiene or like different sexual behaviors. This is the first advice. Then there are physicians and the guidelines that support low dose of antibiotics in different cycles. Personally, I believe that this is not a good strategy, especially for the problem of the resistance, because a small amount of antibiotic in different courses can select for more resistant strains. And then we have other kind of strategies. Immunostimulation is a very interesting strategy, so you can stimulate your defense, especially for urinary infection. Then we have the use of probiotics like the lactobacillus, so that this kind of strategy can work. Then we have the post-menopausal use of the estrogen that again can be helpful in some setting. And then there are some data about the use of cranberry peels or cranberry juice, and they have reported that this kind of strategy can work. So preventive measures are, in my opinion, able to reduce resistance because they are able to reduce the use of antibiotics. And we know that more antibiotic use, more resistance you have. If there are any measure that can reduce the use of antibiotics, obviously you can reduce also the resistance rate. And I believe that preventive measures, the vaccine or the immunostimulation, or even the hygiene measures that you can use in community-acquired respiratory and urinary tract infection are able to reduce the burden of the resistance. So these, in my opinion, are the best strategies at the moment to reduce the resistance rate.